Well, good morning, everyone. I can't see you, but I know you're there. I'm really glad you're able to join us today for our resource management workshop. My name is Aaron Rubin. I'm a science writer, clinician, and PhD candidate in clinical psychology at Duke University. And I'm going to be our moderator. As a society, we are increasingly recognizing the role that green spaces and blue spaces can provide for mental health benefits, particularly for individuals, but also communities. And we know that access to these resources is not shared evenly. And the people who could benefit the most right now probably are not. And this panel is going to focus on helping translate new scientific evidence into practical activities at the level of public policy and resource management. Our panel, which is comprised of really leading researchers and scientists, is going to highlight what we know about nature's mental health benefits and try to focus our discussion on who needs these benefits the most, what initiatives might be able to reach them better, and how we can start thinking about more equitably distributing health benefits through resource management of green and blue spaces. So we're joined this morning by Dr. Matt White. He's a senior lecturer at the University of Exeter Medical School. Dr. Amber Pearson, associate professor in geography, environment, and spatial science at Michigan State University. And Dr. Mireia Gascon, assistant research professor at the Barcelona Institute for Global Health. I'm going to start up by asking our panelists just to give us a quick introduction to them and very briefly mention the kind of work they do.
So I'm Amber Pearson, and I'm a health geographer. So I study how where we live, work, and play affects our health. And one of my streams of research is on the health benefits of nature. And I've done this work primarily in New Zealand and now in the US in Detroit. And one of my focal areas of research is evaluating exposure to nature through both visual exposure to nature and also auditory exposure to nature.
That's terrific. I'm really excited to hear more about that. And do we have Mireia?
Yes, hello. Good morning.
Wonderful. Hi.
I'm here. So, well, thank you for inviting me. I'm Mireia Gascon. I'm from Barcelona, and what I do is mainly research on environmental epidemiology. And in the last years, I have focused on the impacts of the urban environment in health. And one of the aspects that I have evaluated is the exposure to both green and blue spaces. And in fact, I'm involved together with Matt in a European project named Blue Health, which is focused on blue spaces. And throughout the last years, I have evaluated many health outcomes, and including also mortality associated to, or lower mortality associated to exposure to green spaces, mental health, and now I'm developing a new line on the impacts on the immune system.
Thank you so much, Mireia. Well, while we wait for Matt, I'll introduce myself just briefly. I'm a working clinician, so I see patients with mental health concerns in various clinics down in North Carolina. And I do research as well on environmental implications for the development of mental illness. And I'm excited for us to talk about some of the work we've been doing, but also with our panel today, try to generate some new ideas as well. We're going to talk for about 50 minutes, and then we're going to break into smaller discussion groups to hear from those of you in the audience who might generate new ideas for us as well. Then we're going to come back together after those breakout sessions to share back what we've heard and use this online format to try to foster more of a World Cafe style idea generation. While we wait for Matt, I think I'm going to kick us off by starting to ask a few questions. But Freddie, if you can alert us when Matt's here, we'll ask him to introduce himself, if that sounds okay. So Miria, I'd love to start with you. I think more than anyone else in the field right now, you've looked across individual scientific studies to draw larger conclusions about the evidence connecting natural spaces and health, primarily through your meta-analysis approach. And I know you've done a number of big meta-analyses. Can you just tell us what some of the conclusions from your work has been, and what your meta-analyses tell us about who we think we should be targeting with either nature-based programming or initiatives to bring more access to green and blue spaces?
Yeah, I'm not sure if the audience knows what a meta-analysis is, but mainly, or simplifying the concept, is like a summary of the whole evidence, and we put together the different results, and then we estimate an average of the results obtained by the different studies. Having said that, I conducted 3 systematic reviews, trying to include all the, or aiming to include all the evidence published at the time of conducting the systematic review. And well, one of the findings that we observed is that with increasing exposure to greenness or green spaces, the mortality is significantly reduced, particularly due to cardiovascular diseases. And this finding, which was published in 2016, was later on confirmed in 2019 by another systematic review, which focused on a specific indicator of green exposure, because there are many different indicators, and we used one that was common to many different studies. So mortality is reduced, and the mechanisms can be diverse, can be due to the lower exposure to air pollution thanks to the fact that green spaces capture particles. It can also be due to a more relaxed environment, reducing stress for the inhabitants. It can also be due to chemical or biodiversity exposure. So there are many reasons why we found this, and the same for mental health. We also found some evidence of benefits in mental health. However, we need some more studies to actually know exactly which type of green spaces are actually doing this kind of effects, and how we can estimate better these effects. And then we also observed for blue spaces that the exposure to these blue spaces increase physical activity, which has many impacts on health, and also well, on the well-being of the people. With all this evidence, I think we need a little bit more of research to have more details on how we can improve these health aspects in people. And then I think we should target a number of different professionals, not only researchers, but also natural park managers, urban planners, architects, health practitioners, policymakers, so that they understand the benefits of natural spaces, but how we can facilitate access to these natural spaces, and at the same time keeping the quality of these natural spaces so that the benefits are equal for the human beings, but also we respect the biodiversity and the nature that is living there. So we need to find like a balance between the health benefits for humans and for the ecosystems that we are using for this. So we need, I think, a multidisciplinary team or teams to obtain the maximum benefits and produce the least impacts in nature.
I love that idea of trying to build teams across disciplines. I think that might be a nice note for us to have in the back of our mind throughout our workshop today. Well, let's we'll hope for Matt to join us. But while we do that, maybe I'll move to Amber. I'm going to ask you sort of the same question, but maybe with a finer lens. You know, something that we know from Mira's work looking across multiple studies, is that she's been finding evidence that's sort of consistent across different places and different individual research efforts. But I'd like to ask you to give us a bit of a finer lens, showing us, what has your research revealed about nature and mental health, and maybe I could ask you to talk more specifically about what we know about disparities among communities, particularly between white communities and communities of color.
Thanks, Aaron. I first became interested in sort of the nature-health relationship when I was doing research in New Zealand. New Zealand tends to be a fairly pro-equity society in terms of investment, and also so investing in finances and ensuring that neighborhoods have fairly good access to amenities that are considered important for health. So access to green spaces tends to be fairly equitable across the country. And then I've since moved to Michigan as part of the Rust Belt, and I've sort of seen a lot of disinvestment in neighborhoods, particularly neighborhoods, low-income neighborhoods and communities of color. And we actually see a lot of green space in cities like Detroit, but it's from vacancy and demolition of buildings, so it's vacant lots. And I was sort of struck by this and thought a lot about, well, what does this mean in terms of quality of nature? And does that matter? And I think it's really interesting that we can actually have really different fundamental causes for parallel landscapes. So similar landscapes, sort of abandoned homes and lots of sort of overgrowth and green space from economic decline. Similarly, we can for natural disasters. As I lived through the Christchurch earthquakes, we have a similar landscape there as well. And I think that these situations actually are opportunities for us to rethink our cities and really think about how we're going to be pro-equity when we redesign or what we build in these spaces. And it's not just about providing green space and ensuring neighborhoods have green space, but the quality of those spaces. And a lot of cities have implemented greening policies or have invested in the park system in their cities. But a lot of these programs, are multi-million-dollar projects, and they're, fabulous, but a lot of cities are not able to invest those sort of resources. And so I think we also need to think about other strategies for cities where that's just not feasible, and how can we actually provide good quality green space equitably across cities when there's low tax revenue and low city budgets for implementing these sort of things. And I actually have a new project in Detroit, and we're actually looking at one of these options, which is conversion of unmaintained parks due to city budget cuts to ecologically restored spaces. And in this case, we're looking at restored meadows, because that's what Detroit would be if it was not a city, and looking at the health benefits of that. And I think there's a couple considerations for green spaces in cities such as Detroit, a lot of other cities as well, and in communities of color, and that is perceptions of safety of green spaces, of trust in neighborhoods, and also the difference between signs of care and neglect.
Sorry, I lost you just at the end there. That idea of restoring the unmaintained parks is really compelling. Can I ask you just to define for us a little more from your perspective what makes green space quality? Thinking about vacant lots as green makes sense to me, that's not really usable space. Are there ways that our audience can start to think about having more sophistication in the way we talk about or think about green space?
Yeah, and I'll admit that we still have a lot of work to do in this area, so we don't have all the answers, but we do know a few things. And, when we're looking at contact with nature and trying to quantify someone's contact with nature to look at the health effects, we typically are looking at physically being in that space. So the amount of time you spend in a park, for example. But there's a whole bunch of other ways of experiencing nature through the senses. And this is not a new concept. Roger Ulrich, who is an architect who designed hospitals, published a paper in Science in 1982. And he was looking at patients in the hospital with views of their hospital window of trees versus a brick wall, and found that those with views of trees recovered faster from surgery. So we can think about quality of nature through visual exposure to nature, but also through other senses like the auditory environment. And in thinking about the quality of those green spaces, we could be looking at the diversity of vegetation. We could be looking at heights of vegetation in terms of clear view, line of sight for safety. We could be thinking about the quality of the bird song, the diversity of the bird song, and also other measures of biodiversity, the microbiome, and so on. And I think that right now is a really interesting time to be thinking about this in terms of alleviating stress and anxiety, and sort of the evidence we have emerging just now during COVID. There's increasing evidence that people are interested in these types of access to nature that might be experienced actually from within your home, like opening a window and listening to birdsong. In fact, in the UK, the Wildlife Trust webcams found that from 2019 to 2020, the usage of people like accessing the webcams to look at birds went up 2,000%. So I think there's a lot of evidence of people reaching out and wanting to have that contact with nature to alleviate stress and anxiety during COVID. And so it's a really interesting time to be thinking about how we can have other forms of contact with nature and the quality of that nature. As we had lower levels of air traffic, we still do, and lower levels of car traffic, we can now hear more things. And I think that people are more attentive to it. So it's a really interesting moment to be thinking about that.
I'm going to ask you more later about noise, because I think that is an interesting new element to this. But I'm glad you brought up the pandemic, because I think that is going to be the elephant in the room underlying all of our conversations today. You mentioned viewing events as opportunities. You mentioned the earthquake in New Zealand for your work there, but also in Detroit, the sort of condensing of the city, leaving open parcels. I would like us to think about the opportunities and risks that the pandemic's playing now, and maybe Miria, I can bring you into that side of the conversation, because I understand your work has been somewhat, or you've been shifting your lens to think about the pandemic more. Can you just weigh in on what you think the COVID era has meant for thinking through these questions, and either about the importance of nature for people or disparities in access?
Yes, well, actually, I think that the pandemic has also highlighted the idea of planetary health, which is a little bit what I was talking about before, the connection between nature and humans, and that we are just a part of this ecosystem, and that we should take care of the ecosystem in order to survive ourselves. No, so I think somehow the COVID has highlighted this concept and has shown that we need nature. At least here in Spain, people wanted to go out to enjoy nature, and the first weeks we could go out, everybody was in nature. I didn't see as many people as before. No, so yes, I think somehow it has highlighted this need of connection between nature and humans, and I hope this experience is going to push towards more policies for sustainability, promotion of biodiversity, and also not only facilitating access to nature for different socioeconomic levels or ages or whatever, but also how to keep this balance, I was mentioning before, between our needs and the needs of the planet. No. But yeah, and that would be the main idea, I think, for the COVID. So we need to take care of our planet if we want to take care of ourselves, no? And how the different policies or interventions that we conduct, how take care of this balance.
Yeah, can you just talk more a little bit about that balance? To me, it sounds like you might be thinking that there are some trade-offs if we want to, I don't know, encourage people to be connecting more with the green and blue spaces that they have access to, or providing new blue spaces. And I just want to make sure I have it right. Do you see that there's a trade-off, or can we be doing, can we heal the planet while we heal people, kind of thing?
Yeah, at the end of the day, if we overuse a natural space, it will be destroyed. No, so we need to find this balance. Otherwise, what Amber was saying, we won't experience the benefits as much as we would be experiencing if the quality of the nature is the best or the most optimal one. So for instance, here in Spain, at least, we had to, or they had to, some villages, they had to regulate the access to rivers because there was too many people accessing the rivers to spend the summertime and so on. So we had to regulate, and in some cases, even people had to pay €1 or €2, not a lot, but they had to pay. And in this case, then enters the aspect of the socioeconomic aspect, no? Because how people with less socioeconomic, or in a lower socioeconomic position, can they pay? Are they able to pay for this access? Are you then promoting or generating what's the name now in English? A kind of gentrification, like a separation.
Yeah.
So, and actually gentrification is also an issue now in terms of, I don't think in Europe is happening as much, but if policies to increase urban greenness in cities is not accompanied with housing policies, then you might have a gentrification process where you have the intervention, then if it was a poor neighborhood. And I think in the US, it's kind of an issue, no? Yeah, so that's why I was also talking about before multidisciplinary teams in city halls and so on, in public administration especially. Well, maybe it's the European mentality. I don't know how it works in the US, but I think it's very important because then you have multiple visions of one same problem. And yeah, maybe I'm going a little bit out of the COVID question, but
No, I
somehow
think,
that would be the idea.
yeah, I like that you brought it back to that, because in a way I was asking you to help us think about the trade-offs that we might be encountering as we try to bring more scale to this kind of work. One of them you mentioned is there's actually a limit to the number of people that can use a certain natural space before we start degrading it. And if I have it right, in Spain, a new system for charging access had to be implemented. But then you brought up other examples where actually greening initiatives can lead to gentrification. And I saw you, Amber, sort of nodding your head, because I know that's an issue in the United States. Do you want to mention any of your experiences with that in Detroit, or did you have another idea?
Yeah, I mean, it's absolutely true in the US. We have to be really careful about that because, an intervention is implemented in, for example, a low-income neighborhood in order to sort of improve conditions in that neighborhood. And then housing prices go up, and then the people who would benefit the most are displaced. I think one thing that we could continue to think about, and I'm a little biased, I think what's happening in Detroit's pretty cool because it's not a multi-million-dollar project. This is a fairly grassroots project whereby a local nonprofit, that's Audubon Society, joined up with the city Parks and Recreation Department and said, okay, we'll take stewardship of these spaces. They're still owned by the city, but we'll take stewardship of them and ecologically restore them. And it's a fairly low cost intervention. And they're hoping that they're going to put all of their plans online so community groups can take vacant lots and use the same principles to ecologically restore them. So it's not sort of proprietary in any way. And so it's not likely to change the character of the neighborhood so much that it affects housing prices dramatically. I mean, I think a little bit of change is not necessarily a bad thing in terms of like stabilizing house prices in neighborhoods where you're having severe decline and a lot of increasing vacancy. So there's a delicate balance in there, but not likely to change the neighborhood so much that people will be displaced. And I think it's really difficult to accomplish. So I think Maria was, on point there, that we have to be thinking about housing policy in tandem with neighborhood interventions. And it's very rare.
Yeah, I love that idea because I think it is rare. I think it places natural settings into the wider portfolio of what a city manages, not just like it manages sewer, but manages in a way that tries to maximize benefits for citizens across each of these domains. I'm also glad that you mentioned that there could be benefits for the community in terms of the housing stock, right? If there is decline, a new natural amenity doesn't just have to lead to gentrification. It can actually strengthen the community. Can you tell us, I am interested in hearing a little more about this Detroit example, because here we're not just looking at adding new parks, but we're actually adding a restored ecological, a more natural setting. Can you tell us what these park parcels look like before the intervention? Like, were they parks and they were just overrun with invasive species, or like what did they look like beforehand?
So they are parks. They're park spaces, and they have been, most of them, since 1930s, 1950s in Detroit, and they're neighborhood parks. Detroit has a lot of them. There's over 300 parks in the city. It is a large city by area. It's about 100 square miles, so it's a big city. But there's about 300 parks, and about 50 of them are not being maintained as conventional parks. So they are mowed once a year, and that's it. So what do they look like? If you were to drive by, you would probably think it was a vacant lot. So really overgrown vegetation, litter, debris, broken cement, not maintained or potentially absent equipment that people might associate with a park, like recreational equipment. So that's what they look like now. And what they will look like, because they're currently in the process of being restored, is lots of grassland species, lots of flowering grasses and plants. And they're not going to remove any of the trees for public perception reasons. So the trees will be kept on the site, all the new native plants put in, all the turf grass removed, broken cement removed, and a perimeter trail put around the park so it can be used, as well as signage and benches for using the park. So there's also a lot of education that goes on, and also community involvement in the design of the space. So that's sort of like years in the process of working with the community to design the space and then actually restore them. And then community members will be paid to maintain those spaces, so to remove litter and to mow the perimeter trail.
And it sounds like a really exciting project that gets at a lot of the things we've been talking about, with a very sophisticated lens towards being equitable, keeping it a benefit for the community, but also doing something new. I'd like to change tacks for just a little bit and talk more about the science that everyone's doing. And if we could, go ahead.
Matt is online if you want to.
Oh, do we have Matt?
Yeah.
Great.
Hi, I'm very sorry for the late entry.
Oh no, it's fashionable and dramatic. So you've got everyone's attention. It's great to have you, Matt. We've been chatting, obviously, but if you could just introduce yourself to tell us a little bit about the work you've been doing, I'll have follow-up questions.
Thanks. I only missed the first 10 minutes, so it was fascinating listening to Amber and Maria. So my background is I'm an environmental psychologist, so I'm particularly interested in the way environments affect how people think, how they feel, and how they behave. And I've been doing work very comparable to that, which Amber and Maria have done. On the issue of gentrification, I might like just to add that some of the intervention areas that we've been working with is social housing. So there are no house prices as such. And if you're able to work in that area, then that, you can't price people out of the market because it's a social housing supply stock. So it's quite important to potentially work in that area. I also think, I heard some really positive ideas about how things could change during and post-COVID. In the UK, at least, I think we're extremely skeptical about how that will pan out in practice due to the macroeconomic demands. Just yesterday, the UK government saw through a bill that basically allowed mega trawlers to trawl through even marine protected areas in the UK, because they're after the quick buck recovery. Basically, the economy is in such massive crisis in the UK, they're willing to do anything to exploit the environment to get it back on ground. So how on earth we stop that happening when all the evidence points to these very short-term gains? I think we're going to have real issues here during the macroeconomic climate. Sorry to come in and be so negative, but it's been a really bad day in the UK because of the economic costs.
Yeah, I'm glad you brought that up, because I do want us to keep talking about the challenges that the pandemic is going to pose. But I'm also going to ask us to try to take that optimistic side and view it from Amber's lens of, okay, here's this opportunity. I might take this minute just to plug my own experiences in the clinical world. We've seen demand for mental health care truly skyrocket. So in the US, as of this summer, when a lot of large national surveys were done, we found that about 1 in 3 Americans were experiencing significant anxiety and depressive symptoms. And I do sleep work now, and we find that for our insomnia clinic, our wait list has doubled its wait times. So now it's many months before you'll see someone. So I would challenge us also to view the pandemic as an opportunity, in the sense that if we are trying to target mental health benefits, the time has never been greater for a need for mental health benefits. And I think more and more people are going to be looking for this kind of service. Matt, I'd like to use that to ask you just to tell us about some of your more recent work trying to narrow down questions about dosage and what it is we would like people to be getting more of.
Okay, time to put my positive hat on. It's all going to be great.
Yeah.
Just need to get people out there and doing stuff. Right. So some of the research we've been doing, we've been using very large representative samples across the UK and with Maria and team around Europe and the world. The current piece of work, we're working with 500,000 people that have been, data has been collected by the government over the last 10 years. And looking at all that data, to cut a very long story short, what we find is that people who are doing 120 minutes exposure to the natural environment a week are showing significantly better mental health. Now, this is cross-sectional data, but we're able to structure it in terms of, things like age, gender, ethnicity, income. And what we find is that the 120 minutes threshold is true for men and women, older and younger adults, all ethnicities, people living in rich areas, poor areas. It's the same for people with physical disabilities and so on. So basically it seems to apply to everyone. What we're really fascinated in was, how do you get your 120-minute a week dose or 2 hours a week? It didn't seem to matter. Some people just went for a 2-hour walk with their relatives or whatever, and that was enough once a week. Other people were doing 4 times 30 minutes a week, and that seemed to be fine. And what we realized is that people at different life stages could fit nature around their lifestyles better at different times. If you've got a busy working week, maybe that weekend walk for 2 hours is the only way you can do it. If you're retired and you'd find a 2-hour walk difficult, perhaps, small snippets seem to be the break. Clearly what's needed now, and I'm aware that many people in the States are pushing this agenda forward, is really good controlled trials to see whether there is a time threshold over the course of a week. I think that's the next step. The other work I'll just point out before handing back to you, Aaron, that we're doing with Maria, is we've been working with a very large sample internationally of 18,000 people. about 2,500 of those have clinical depression or anxiety. And we've been looking at how they naturally use the environment to support their own mental health, not through the prescription route. And what we find, I was extremely surprised to find this, people with depression visit nature just as often as people who aren't on any medications and so on. Traditionally, people with depression find it quite difficult sometimes to get out of the house. People with anxiety disorder actually spend more time in nature than people not with any conditions, which was fascinating to us. And they were reporting huge self-management benefits with one caveat. And the caveat was, if they felt pressured to visit these spaces, they were actually visiting more. People with anxiety and depression were listening to friends and relatives, well-meaning to get out there, but because they felt pressured, they were enjoying it less and they appreciated nature less. So the message really seemed to us was that, you really need to work with people to support the things they want to do, not just say, look, green space is a silver bullet, get out there, because that can have a negative kickback. Sorry, I'm going on a negative again. The bigger picture is fantastically positive.
Yeah, I think that's actually a really exciting series of findings. Let me ask you just briefly to tell us a little more about this pressure component, because I think it will influence the way we try to think about bringing holistic programs onto this new marketplace. What do you know about the pressure that was making the experience bad?
Sure. And then, I'll hand back to you because I know that you're actually dealing with that in a good way. So as a psychologist, one of the big core theories we work with is something called self-determination theory, and has 3 elements. It says basically your well-being is a product of you belonging and feeling connected to other people. It's feeling that you have skills and mastery over the world, but it also is about autonomy and control and feeling that you get choices. And if you're cutting down people's choices and taking away what they believe is their own autonomy, you're undermining their self-determination and you're undermining their well-being. There's thousands of studies showing this. So it's not new. It's just not been applied to the idea of green space research before with this particular cohort. So it's not surprising on the one hand, but we've brought it to this field. So what we're saying is you can't just prescribe green space. You need to work with people to fit in green space around their wants and needs. And I think I'd like to hand back to you to talk about how your experiences have been with that.
Yeah, I think I love that you've brought in this this deeper understanding of psychology, because I haven't heard about that in the nature space. And something we've often talked about in the research world is, do we need to be providing more opportunities for people to get out or have contact with nature in sort of a passive way? Or do we actually want to be pushing them out through prescriptions, through really active programming? And, from the clinical world, I see folks who have already slipped into what we'd call an impaired state, where they have a diagnosis, where their functioning is much lower than it used to be. And we are very much taking an active stance. We want to intervene. We want to get them off the couch and outside. I don't think we think enough about some of the negative consequences that can have for people's feelings about self-determination and autonomy. And I do know that some of the most interesting research coming out has shown that if you provide cleaner parks, new parks, people see mental health benefits, even if they're unaware of them. Which makes me want to ask Amber a little bit more about some of those passive environmental exposures you mentioned before, like greater species diversity, greater differences in noise. Could you tell us now a little bit about the way you're being more sophisticated about nature contact and how you're measuring it in your studies?
Yeah, so like I mentioned, there's a lot of work that can be done in this area. We aren't doing everything, but we are quantifying visual exposure to nature using both GPS units, so we know where people are, and then we use 360 camera imagery and Google Street View imagery to quantify what people see when they're outdoors, and then we can quantify what they see from their front door or from their front window of their house using viewshed analyses. which I've also done in New Zealand. And there we found actually that views of blue space were significantly associated with lower psychological distress, but not views of green space. But again, that was in Wellington, which has a town belt of high quality native forest all the way around it. So not a lot of variation in terms of visibility of green space, no matter where you are in the city. And we are quantifying auditory exposure to nature by creating, randomly assigning locations for audio recorders throughout each neighborhood we're working in. And those recordings are then listened to, and bird species and insects are noted. And then we can create soundscape maps across the neighborhoods in terms of exposure to natural sound. And again, we could also look at exposure to anthropogenic sound as well, like car alarms and sirens and that sort of stuff as well.
Matt, can I ask how I keep coming back to your magic number of 120 minutes, really that amount of exposure, we see mental health improvements at that peak level. Does that finding include these sort of passive exposures? Or is it more about getting out, being surrounded in like an immersive park setting?
Sorry, yeah, I should probably clarify. 120 minutes isn't the peak. The peak is around 6 hours a week, actually. 120 minutes is the minimum threshold at which we see these significant benefits. The peak is about 6 hours a week. After that, we see a tailing off. So, spending 7, 8, 9, 10 hours might not be particularly good. When you actually look at the detail quite carefully, that's quite often dog walkers. In the UK, the winter temperatures are not particularly pleasant. You still have to walk your dog, and we suspect that some of that drop-off is actually related, again, to the pressure to feel you have to be out there, e.g. to walk the dog, even if you don't want to be out there in the rain. So there does seem to be a beautiful dose-response curve. In terms of what the exposure types are, that's an extremely good question. We haven't looked at the 120-minute threshold in terms of quality, but we have looked at quality in various ways in terms of biodiversity, but also things like, safety was mentioned, particularly in the keynote speech earlier. Those issues of feeling safe were really important. Levels of vandalism, levels of biodiversity, and various other things. And of course, what you find is in the poorer areas, safety's worse, maintenance is worse, facilities are worse, and biodiversity is lower. So improving the areas in the poorer areas will improve well-being, because well-being on the visits is associated with that quality. But we still need to join those two pieces of work up. Is, for example, 4 hours in a poorer biodiverse area as good as 2 hours in a high diverse area? I don't think we know that yet, unless one of the other speakers knows better than I. I think that's something left to do.
Yeah, I am curious, Amber, if you've found anything with your more sophisticated lens now. I know you're still in the preliminary stages.
Yeah, we don't have that answer yet, but we could start to get a little closer to answering that. Again, this isn't sort of a nationally representative sample. It's over 90% African American, a large percent unemployed. So it's not sort of that massive sample that you'd hope.
But it is, to our underlining question about equity and access, it is a population that we know is disadvantaged in terms of having access to mental health care, having access to nature. So it will be an interesting population. With our last few minutes, I just wanted to move back to Miria for a second. You've mentioned a few times the need to build multidisciplinary teams, particularly from a policy lens. And I know you had some experiences as a civil servant. Maybe to finish us off, could you just tell us a little bit about your experience in that realm and whether there's lessons we can draw from that as we go into our breakouts?
Yeah, well, of course, I was not in the government of my city hall. I was in the opposition, but what I could observe is that in the public administration, often the different departments work on their own. They are not connected. And I think this is one of the things public administration should work on. Especially, I think putting health in the center, then it's very easy to connect the different areas, That that would be my conclusion, a short conclusion about my experience. And actually, within the Blue Health Project, we have conducted some interventions that in which both architects, for instance, urban planners, and health researchers have been working together. And I think the interventions have been quite successful when these different aspects are taken into account. Well, for instance, here in my city, we applied a method which is called Steinitz method. And and also it was we included a participatory process with neighbors of the locality, well, the place where we were doing the intervention. And by taking into account their perception of the urban and the natural space, it was like a semi-urban, semi-natural space, we could define a map of the red points where we had to do the interventions. And thanks to this, we were really, we did like a urban acupuncture. That's a concept that we use in Blue Health, by using few money, but pointing it or using it very strategically to focus on these red points of the perception of the urban space. So I think it's very important also to include the neighbors or the citizens in when defining this kind of interventions. And sorry, Aaron, but well, there's a reminder that we are going behind time, I think, but there are some questions from the listener, well, the audience. I don't know if we want to answer these questions, but
yeah, I'm trying to see how I can get access to those.
We go to chat below. There's a, well, let's say chat.
Yeah. So we are going to go on a break, but let's try to answer one or two, and then we'll have a break before our breakouts. Yeah. Let me just scan one or two.
I can answer the one on memory and attention.
Yeah, please.
Raised by Suzanne, because she's mentioning that independently of the experience of the participant, the attention and the memory increased by 20% after being exposed to nature. And I think we should separate what is mental health, more like feelings of depression or anxiety and so on, and separate it from the cognitive aspect of the well, because for some people mental health is the same, but it should be separate. And for instance, in Barcelona, we conducted a study where we observed that children studying in schools with more greenness also had better working memory. So and they were not forced to be exposed, well, they were kind of forced to be exposed in this green space somehow. They were not aware of this, but I think we should separate mental health from cognitive aspects. And then there's also another question regarding the difference or the definition of nature or green space. Matt, maybe you want to mention that difference or how we define this?
Yeah, I'll just read it out loud. The question is, do we have a common definition of nature or green space? And is it important that you have, how important is the experience you have? Like, does it have to be physical activity? Do you have to meet people there? Can you just go and sit by yourself? Are they all equally important? And I would say Matt or Amber could answer that.
Yeah, I think we'd all have, if we all tried to write a definition of what we thought nature and green space, and there's about 30 people on this call, we'd all come up with something different. The ecologists would come up with something very different. I think it's actually quite, it sounds cute, but it's quite a challenging concept in many ways. A lot of the research in the health literature has looked at green space from above. It's just basically worked out, well, how many trees are there? What's the amount of greenness in the area? And that's why Amber's work's so cool, because it takes the person perspective, either from their home or potentially as they're walking around. So it's very much a person view of what green space is. I mean, as Maria alluded to, a lot of our work has actually been on blue space, because we realized when we analyzed pretty much 10 years of the early research that compared so-called green space and urban space, in reality, they were comparing blue spaces in rural areas with no blue space in urban areas. So what we found is actually an awful lot of the effects were driven by blue, were driven by rivers, lakes, canals, and the coast. And that was actually the green space effect. So that just goes to show that even what's defined as green space needs to be disambiguated and pulled apart, because, you know, trees and the coastline are really quite different spaces. And I know Amber's thought a lot about this as well.
Yeah, did you have anything you wanted to add, Amber? There is one other question we'll probably do before we break.
Let's go to the other question.
Yeah, so this last one might also be for you, Amber. It comes from Phil Rodbell of the U.S. Forest Service, who's asking, how important is a sense of greenness and pride in place as a component of mental restoration during neighborhood walks, for example? You know, to what extent does being connected and feeling proud of your neighborhood make a difference?
Yeah, and I don't have a great answer to that, but we definitely know that there's a whole bunch of feelings wrapped up in that. There's trust with neighbors, there's feeling safe to walk on your street, there's feeling connected to your neighborhood. All of those things are tied up in behaviors around using outdoor spaces. If you don't feel safe, you're definitely not going to let your kids play at the park, you're not going to walk around the neighborhood, you're going to use that space really differently. But measuring some of those things is challenging in terms of your kind of perception of your neighborhood. I am measuring some of those dynamics in Detroit, but I don't have a great answer yet.
It reminds me of some conversations I had with Gina South, who looked at the mental health benefits of greening vacant parcels in Philadelphia. And she said that they found that folks enjoyed better mental health after these initiatives, even if they were unaware of them. And one reason may have been that they contributed to feeling like the neighborhood was cared for and that you lived in a place that looked after itself.
And that's that signs of care versus neglect that I was talking about. Yeah.
I love that.
Yeah, I'd say we found the same in some of the interventions Maria was saying. It was mainly, we looked at mediation analysis, it was community cohesion and safety that were the key drivers for us as well.
I think that's a really great note to end on, as we try to think about making these efforts equitable, and maybe it comes down to a lot about helping the community stay together and build more cohesion and pride. Let's just take a 5-minute break. So if I have it correct, you can stay on this line and we're all going to be sent into breakout rooms that are going to be, looks like just under half an hour discussions. We'll have 2 half-hour breakouts, and then we're going to come back. The 4 of us and a few other breakout hosts are going to say back what we've heard from everyone who's on the call today. I'm really looking forward to this. I think the chat has shown me there's a lot of neat ideas that are going to come out. So we'll see you all in about 5 minutes. Looks like we've got most of our hosts back. I don't know about you guys, but we had really great conversations in my group. I'm going to ask you now to tell us what you heard in your group, if you had any main takeaways. I'm just going to call on you one at a time, and we'll have our hosts who people haven't met yet just introduce themselves. Let's start with Amber. Oh, and if you could just tell us your sort of orienting question, that would be good too.
Okay, sure. Yeah, my question was, what did the panel not cover regarding mental health benefits of nature that you believe are important? And we had a couple themes I'd like to pull out. One from a really practical perspective, people were curious about sort of what sort of is enough for cities to do to get some of the benefits. For example, if we make a street pedestrian only in a city, is that going to be enough of a positive exposure to nature, or do we really need to see the benefits sort of outside of the urban environment in a forest kind of a thing? So I mean, those are definitely questions we haven't fully answered, and so I agree that we need more work there. And from a practical perspective, that would help city planning efforts and so on. And kind of leading on from that, how do we sort of meet people then where they are? If they're, how do we make incremental progress to get people comfortable in using outdoor public spaces? So can we kind of start people experiencing nature in cities, and then move on to maybe more wild spaces. And as part of that, how do we reduce fear of people of using those spaces so they become progressively more comfortable and eventually use trails and the larger park system. And then we had a really interesting discussion about reduction of fear and increasing safety in these green spaces and blue spaces. And people discussed a lot of different kind of ideas around that from both the individual level in terms of like the Parks RX system, where you might be working one-on-one with a patient to get them out to enjoy the nature, meeting them where they are, figuring out what their needs are, and kind of starting there. We also talked about using common language around sort of introductory experiences, and then when people are ready, moving on to more, I guess, immersed sort of experiences, and how far people want to kind of take their exposure. We also importantly talked about ways that we might make spaces more not only safe but inclusive, and how could we do that proactively rather than reactively. And there were discussions about how we could do that sort of in the space itself, including like QR codes in parks that could be used for engagement, but also safety features like markers with GPS coordinates in case you need help, and also posting suicide hotline information and contacts for the sheriff. And then on the back side of that, making sure that planners are working with those agencies to make sure that they can actually safely serve those green spaces if they are remote or hard to reach, and running scenarios for safety to make sure that proactively we're prepared for what might take place in those spaces. And one kind of additional thought was about, I thought was really interesting, was about mindfulness when in green space or blue space, in terms of people with their earbuds in or staring at a screen rather than actually visually interacting or auditory wise interacting with that natural space, and whether those same benefits would be received. So I thought that was an interesting point for discussion and for potential research. And the example that was used was sort of this widespread use of Pokemon Go. So people are staring at a screen, but they're using the outdoors. And the question is, do people actually receive the same or similar mental health benefits? Great group discussion.
That's great, Amber. You guys really touched on research questions, questions about policy, questions about agency readiness to respond to events in natural areas. I love that. Let's move to Matt. I'll keep us going just because there's a few of us.
Yeah, thanks, Aaron. But special thanks to everybody in both of the groups. I'm amazed at the diversity of responses, actually. So that was really cool. Some things touch on similar issues that Amber raised, but I think, and I hope I'm doing this justice, there were 6 themes that I think came together.
And Matt, can you just read us your question real quick too, so we know what you're...
Yeah, the question, I do apologize, was basically, is the research done and dusted? Do we just need to roll up our sleeves and get on with it? Or do we need some types of research for different types of stakeholders? And I think the answer was yes and no. So if I understood it right, there was a number of people who said, we've got a lot of evidence from self-report data. We need to up the ante for particularly the medical community to bring in much more sophisticated physiological data, for example, looking at immune function, this kind of stuff, to convince the medics. On the flip side, there was some really interesting discussions about we need much more in-depth qualitative evidence from people about what their fears, concerns and motivations are to or not spend time in nature. We really need to be listening to people a bit more in-depthly rather than just rolling out the usual questionnaires where we dictate what the questions are. And I think both sides of that scale have a lot of value. There were 2 also interesting bits, which I'm sure will appeal to lots of people. Not that we need more health evidence, but that we need the economic evidence of the return on investment in health. That still seems to be important. And particularly what came through is not at the national level, not even at the state level, but actually at the city level and this park level. So the economic return on investment for health needs to be done at a much more bespoke level. I think it was a lady called Elena who also pointed out that it's actually the logistics evidence is needed. So we know these things could work, but what is the best way to make them work? So what we need is process evaluations of the best mechanisms to support people rather than whether they're good for people or not, because some programs will work and some won't. And there's a research story there to do about the best mechanism, not necessarily the most appropriate outcome. Two other things I'd just like to add quickly. Several people said, look, there's evidence here, there's evidence there, there's evidence in landscape, there's evidence in medicine. These people haven't got a common language and aren't sharing this appropriately. So it's not about collecting more evidence, it's about more effectively being able to translate the evidence we've got across different communities. And that might be at a policy level, bringing health people and planners into rooms together to discuss their perspectives and to listen. And finally, you know, not surprisingly, COVID came up for a number of reasons. The idea that this is a time more than ever, as we've discussed before, that, you know, mental health is being challenged and so on and so forth. But also, what are some of the risks of spreading COVID? People might say, well, you can go outdoors, it's better than being indoors at a cafe. But there are crucial points in outdoor environments, park entries, you know, bridges and these kind of things, where actually we could be transmission spreading. So as well as promoting it, we also need to be extremely cautious about doing so at the time being, and for some time to come. It's going to be months before a vaccine's out there, let alone the rest of us actually get it. So I hope that sort of summarizes some of the key points from both the groups.
That's fantastic. Lots of new ideas about ways we could be doing this better from the research lens. Let's move to Miria.
Hi, so the question in the room was, what's the biggest challenge or barrier faced by your community that could be addressed by better access to nature? And what are some potential solutions in terms of policies, programs, or interventions? The different comments that were raised were difficulties in addressing access inequity in the community. That was one of the points, but actually maybe we didn't have like potential solutions some of the times. In one of the interventions, they suggested that sense of belonging is important. And so that if people feel attached to the place, then it's easier that they use the space. And for instance, they mentioned a program called Mi Casa es Su Casa, which in Spanish means my house is, or my home is your home. And one way to implement this program was by creating short videos in multiple languages and showing how the trees, the birds, or different aspects of the natural environment were different or were the same across the different languages or places of birth. Also, one of the persons say that we need to increase access in cities, and to do that, it's mainly through three interventions. It's more funding for parks, coordination skills and capacity at the municipal level, and demand for more spaces. So within the urban context, more spaces. And then also, for instance, that we do not only promote central or like the important parks, like the central parks, but also it's important to promote parks of proximity, so that it's easy that anyone has at least a nearby park so that they can easily enjoy nature. And I don't know if I'm forgetting anything. Oh yeah, and then another issue that was raised was the seasonal use. For instance, there's this intervention on garden lots that, well, of course, in winter the activity is less, or I don't know, also other difficulties in the less activated seasons. I don't know, like summer or winter or spring. Sorry.
Yeah, that's great. I just want to follow up on one of those. You mentioned that sense of belonging came out as an important theme. Did anyone have any suggestions about ways to foster that regarding green spaces?
Well, they say they suggested these short videos where they would have multiple languages, and then comparing different species of birds, for instance, between, I don't know, if I, as a Spaniard, I would go to the US, they would compare trees in Spain and trees in the whatever area of the US. So things like that. And also they also, I forgot to mention, um, like instead of up-down information process, sharing information process where people learn from each other and because people want to be in contact. So instead of someone telling, no, I don't know, a teacher or whoever, or a guide, or saying, okay, we have this tree and blah, 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 so that the different users of the park share this information and experiences and knowledge they have about nature or historical sites, for instance, as well.
Oh, that's great. Thank you. Daniel, let's have you report back. Can you tell us just a real quick introduction to who you are and what your group was talking about?
Sure. Hi, everyone. I'm Daniel Hatcher. I'm the Director of Community Partnerships at the Alliance for a Healthier Generation. I put our question in the chat box for everyone to see here. Can you share an example of how COVID either connected or disconnected you and your community from nature? And then how has this impacted mental health? I think one of the resounding themes from the two conversations was that our staff are absolutely at capacity. There were some great examples of how park and recreation green space has really been stepping up this summer, like Gwinnett County with serving meals to families. The pivot of staff who might have been serving as a lifeguard now playing a different role. So I think everyone really acknowledged that this pivot and shift has really taken its toll on staff, and that we need additional resources to support staff. And also a part of that was just the toll that more folks visiting parks and green spaces has had on additional trash or security. There's just been so many things, and again, you know, acknowledging the weight that that's putting on staff in our parks and green spaces. So that was one piece. Another layer on that was just this imperfect storm of COVID, in addition to the protests this summer and wildfires. There's just a lot of things happening that are compounding these issues and reinforces the importance of a collaborative approach that is small enough to be nimble, but collaborative enough to have collective impact. So that was the second piece. And the third, more focused on steps and actions that we can all take, was thinking about steps that we can take individually, as well as recommendations for resource managers. And lots of great examples came up, everything from ensuring that dogs are on leashes so that if someone's new to a green space, they feel comfortable and safe. Being there, signage that makes it clear about taking trash out of the green space. I'm acknowledging that there could be some language and roots of white supremacy and leave no trace principles, and being aware that when encouraging more folks to enjoy those spaces, that has to be done in a way that's really respectful of everyone's experience or lack of experience in those green spaces. So staff at capacity, collaboration, collective impact needed, and then action steps have to be both at the individual level, but then channeled to resource managers who can make it consistent across the country.
That's fantastic, Daniel. That's nice because it really brings us into the land management perspective, which we've been hoping for. I'll talk a little bit about that as well. Let's move to Elizabeth now. If you can just give us a little background to yourself and the topic of your group.
I'm going to follow Daniel's lead and post my question into the chat.
That's a great idea.
I'm Elizabeth. I am a Master's in Environmental Management student at the Yale School of Environment. And our question today was kind of looking at cross-sector allies, collaboration, and how to reach vulnerable communities and to provide the mental health benefits of natural spaces. And it was kind of amazing how many people were doing cross-sectional work already. So I thought that was great. We talked a lot about how the pandemic has brought hardship, but it's also brought us all together to discuss the health benefits of nature and made it easier for these collaborative efforts because more people are aware of the issue. How important it is to look at where access to natural spaces is available and where it's absent, and how that can help you identify people to collaborate with based on who can provide or support for increasing access, which also includes understanding the barriers to access, like transportation, and ways to make participants feel like they belong in those spaces. Talked about being intentional with your collaborative efforts and using this opportunity to highlight new voices. Then taking time to sit down with people in the different sectors to hear about what they need and how you can support each other. Then also being aware of the constraints that are put on these organizations and peoples, how there's limited time and money. So it's great to come in with like a goal in mind while leaving space for discussion to make sure you meet everybody's needs. Discussing how important and difficult it is to learn about new partners, and how those partners can be in very diverse fields, but also how there are a few people whose job it is just to bridge those gaps. And that might be a space for people who have a generalized knowledge of an issue, and they can pull in those broader actors and get them around a table in an easier way than somebody who's super hyper-specific in an issue. And the final point that I thought we should highlight was kind of ensuring that public health is highlighted in every action your organization or your coalition is taking, and making sure that's part of the conversation early on to raise awareness of the benefits, but also generate new ideas by directly engaging your partners in a conversation they may not have otherwise been a part of. So that's the gist of it.
Great. Elizabeth, I'll ask you to turn your mic back on because I just want to follow up on one thing, which is you mentioned trying to highlight new voices. And I just wonder, do you have an example or anything that you can give us more details about there?
Highlighting new voices, there were kind of youth advocacy groups and reaching out to get people engaged young, and then highlighting kind of heroes of color. I think Jason Ward, a birder, was brought up, and just being able to provide examples to minority or underrepresented communities of people who came from their community who are doing nature-based activities.
Got it. That's great. I think that's a really important point. Thank you. Let's move to Lisa. Oh, was Lisa the person who didn't end up? Now I'm remembering. We lost one of our guides. Okay, well that's great. That gives me more time to talk. So I'll share with you guys what we found in my group. I will also put my question in the chat because I think that was a nice move. So we were asked what sort of opportunities could be realized if land managers began to think of themselves as mental health providers? And if so, what stands in the way? We had a couple big themes come out. A really common consensus across our conversations was that we actually don't talk about health benefits enough. So we had folks from national parks, land trusts, environmental education groups, veterans, conservation coordinators, researchers, and even though we all think that we talk about this with each other, there was a consensus that we're not doing that enough outside of our organizations. What's interesting is at least one participant from a Parks and Recs department said that in the time of COVID, internally, they're really clued into the idea that they are seeing themselves as mental health providers. And they've started talking about that a lot, which is a really new idea that a Parks and Recs department would be talking about themselves as mental health providers. That said, they don't see in their audience of users recognition that they might be getting mental health benefits. So they're trying to do more talking about that. The second thing that came out is in the time of COVID, we've seen massive increases in the use of parks, public spaces. So the same Parks and Recs person who was from Denver noted that they've seen a 450% increase in park usage. Related to that have been growing issues about stewardship. So they've had to triple their trash pickup service. So even though we've decided we really need to be talking more and more often and more loudly about mental health benefits, we might also need to dial up our conversation and messaging about stewardship so that people are using these spaces in a way that isn't going to degrade them. An interesting idea came out, which I'm going to highlight for our research community, which is that we've been thinking about mental health benefits from nature as this sort of, I'm out in natural spaces, I'm calmer, I'm experiencing the sights and sounds, Amber. But there's also this thread of you can be an active participant in stewarding the land. So we had a participant who connects veterans to conservation efforts, where they're building trails, where they're removing invasives, and they've seen transformative mental health benefits. And so can we think about stewardship as being an active land use, not just recreation? And can we actually measure those benefits? That would allow us to target, high-risk groups like veterans, but also gets at the question of how we connect people to the land without degrading it. The last main theme from our groups is that partnerships have to be the way forward, because land managers, parks and recreation departments, parks rangers all feel understaffed and under-resourced, and asking them to think of themselves as mental health providers is asking them to move into a new role when they can't even fulfill the roles that they think they need to be providing now. So they said, look, I don't know that I have the RAM to take this on, but I really welcome mental health providers coming onto the land. And can I welcome counseling groups? Can I have services that are brought in through partnerships? We tried to talk about how you do that, and an interesting idea came up that I would challenge everyone listening to think about their current organization and how they can do partnerships internally. So is everyone within your group on board with nature and health? Can you start to shift perspectives in your own city, council, in your own agency? That is going to be free. Then the last thing was that for folks trying to connect people to land, finding a champion in the mental health space or the health space in general has been critical. And that is the only way they see that they can engage people to come out and use the lands in a new way where they feel safe and where they actually perceive that there are health benefits. We didn't really have ideas about how to get those champions, but that puts the onus on us to start connecting with the healthcare sector more. But lastly, I just want to end on a positive note. Our person from the Parks and Recs department in Denver, who mentioned use of land is exploding, trash is exploding, also said that in this round of budget planning, they did not see their budget cut, even though the city has a huge shortfall. And in fact, they've been given more money for new programming. And the reason is the Parks and Rec department was given credit for helping keep the city together socially and emotionally through the crisis. And it's recognized that we're not through the crisis yet, and that our lands are going to be a huge part of bringing us through this. And I thought that was really exciting to remember. Even as we're good at defining the problems, that's that opportunity is there. So that's sort of the big cross-cutting themes from our groups. We've got a little more time because we lost one of our groups. I would encourage participants to drop questions into the chat, or even raise your hand. And while that's happening, I might just push to our panel whether any of the things you heard from the other groups has generated any ideas that you'd like to share.
I wonder, not to try and put anybody on the spot, but there are a couple of people whose ideas really came through, and I wonder if they'd be willing to share with the whole group their discussion. I was thinking particularly Susanna Bartlett, Hanson Miller had some ideas, because as a medic and a practitioner, she was able to span both fields. I wonder if she'd be willing to share some of her thoughts.
I love that idea.
Hi. Yeah, I'm not sure what you wanted me to share, Matt.
Well, your experience of being in two almost different camps and having to translate between them seemed really important.
Yeah. Well, so as I shared in our small group, I'm a physician who started as a conventional physician who would have never been in a group like this talking about such things. But due to life changes, I studied integrative medicine and have changed most of my focus now to nature as a healing modality. And so I prescribe nature. I take people forest bathing. I've written a book about it. Recently, I shared with our small group, I worked with Dr. Robert Czar of ParkRx America, Dr. Kathy Wolf, and Dr. Courtney Schultz in creating a webinar that's an hour long that offers continuing medical education credit to physicians and other health professionals. And so that's available for anyone to watch. I put the link in our small group, but I can add it to the larger group if people are interested. Anyone can watch it for free. It's $35 for the continuing medical education credit for providers who are interested. I do think it came up in our small group that there's so much of this that's about communicating the health benefits. And so I do think that there's something important about having somebody who can bridge those gaps, bridge that communication. That's something that I enjoy doing. So, you know, I'm certainly very happy and interested to work with groups who need somebody to be able to have one foot in the conventional medicine realm, one foot in this realm. I can wear my Birkenstocks, I can wear my pumps, I can wear whichever is necessary to connect with people and speak whatever language is necessary. And I do really enjoy that. I think that's part of my dharma, so to speak. So yeah, and I'm happy to answer questions or discuss further, whatever is necessary.
Thanks, Susanna, especially as being put on the spot. I'll hand it back to Aaron.
Yeah, no, that was wonderful, Susanna. And, you know, I encourage people in my groups, but now to view this as a slightly larger small group, to really reach out with folks here whose work is resonating with you, because we do want this to be a space to recreate some of those conversations we would have had. And I'm going to pull from some questions that are coming in, but I love this idea of calling on people. I'm wondering if I can put Seva Goshen on the spot, if you're still with us. Just to, you were the person from the Parks and Recs department who I mentioned had been viewing their new role as mental health providers. And I just was hoping he could share with us what that has been like.
I'll be happy to. So again, Seva Ghosh, thank you, Aaron. Appreciate it. So just kind of going back a little bit, when we got into the crisis situation in the first week in March, you know, we basically hustled very quickly to get things going. It was also the time for hiring seasonal staff. So we were stopped on that piece, so not being able to hire seasonal staff. But what came out of all this is the staff came together as a team. So it was kind of, you talk about partnerships and so on. So building the team together, we did it more internally. So all the city 9 departments came together and made all the good things happen. So park usage obviously shot up after the initial 5-week shutdown or complete shutdown that we experienced here. But since then, as Aaron related earlier, our traffic is up close to 450% in our parks specifically. The centers are obviously limited to a 50% capacity currently by the health authorities. So, but overall, what it has done is made us stand out as a department in the city hierarchy. Typically we always fight with police, fire, public works, and so on. But we were basically labeled an essential service, and even we went through a few hiccups, but overall, we have become the go-to department for a lot of things. And also, credit to the team that we have, that we did our jobs very well. We stuck together. Mental health is an issue. Obviously, we talk about the community, but also about our staff, because they were in harm's way over the course of the last 5 months. Even myself, I've been coming to the office since March 10th, and so on. So a lot of those things played a major role in us coming together, building a team, internal partnerships. And then when the budget season began in in September, and we just approved the budget here last week, we were able to receive funding and get the things we all wanted and moving forward without any cuts that actually have any impact to the department, so any negative impact. So all positive for the department. And I think we're making a lot of headway in proving that parks and recreation is essential to the community.
And Seb, if I can just follow up while you're here, you mentioned to me that you guys internally have started to talk about how you're providing mental health benefits for the community. Is that a change since the pandemic, or has that been part of your Parks and Rec department ethos for a long time?
Actually, it has been a part of my operating ethos for a long time. And the great opportunity here in Colorado is everybody loves the outdoors and, does talk about it. So it was easy to break that, that mold, so to speak, and move things forward. So even before COVID, we were always bought into it, but COVID obviously put it into the limelight, and brought it to the forefront. And we are playing a major role, overall.
Yeah. Terrific. Thank you so much.
No, thank you.
So on the Q&A, I've just seen notes from other folks around the country that they, like Seva, have seen a consistent budget for the next year as a result of being viewed as a essential service during COVID. And they had a question for everyone, which is, how do we use this conference to compile these kinds of funding wins into support for our global movement? I don't really have an answer to that. I think it's a good question. I'll put it to the panelists, but we could also open up if anyone in the group, the wider group, has an idea. Yeah, it's a good question. I don't think we know the answer. Anyone on the panel have other things they want to weigh in? I'm going to look on the Q&A for other questions as well.
I mean, I think that picking up on some of the things we've talked about already, talking about the economics, like what are the economic benefits of, for every dollar spent on parks, what are you getting in return, kind of a thing. I think that often that language speaks well to that crowd.
Yeah. And that reminds me, Matt, of the idea from your group that we've actually seen some really high level economic analyses, what are the benefits of parks at the country level? But what it sounds like is we need really boutique local analyses. Can you tell us a little more on that?
Yeah, I don't know. Have you hacked my computer? No, I'm just kidding. We've actually just about to submit a paper where we've taken the national level at the UK and broken it down into local authority level. So we've got about 320 local authorities, and they're the bodies that are responsible for the park budgets in the UK. and we've done the economic assessment of the benefits for mental health at each local authority level, because that's what people were really asking for. So yeah, no, I'm just teasing you, but exactly, we've had to listen to what evidence level people wanted, but getting levels of economic at that very small specific level requires huge samples, and that's why we have a 500,000 people in order to be able to generate that. You can't do that with a few thousand people, because of course you can't cover a whole country. In the States, you would probably be talking about a data set of 2 or 3 million people to be able to generate that kind of level of specificity at a global level. Otherwise, you still need pretty large samples. I think that's the thing that's holding the economics back at the park level. But other people might have a different perspective.
This is Attila. I got a response to that, if I can, Aaron.
I would love that. Please.
Shift at last year's Shift conference, there was the outdoor recreation economic benefits, and so Shift is now starting to explore a trails health calculator tool, and that idea is looking locally. So looking at the healthcare costs, looking at trail construction costs. We're going to probably pilot that in the Brownsville, Texas area, where some great work's being done by Rails Trails Conservancy, where we can actually then go in and say that, hey, if you invest $2 million in this trail, not only is it going to have access to 3,000 more people, but we can show that over this course of time, we'll have this much in the healthcare savings. So I think that's a piece of the puzzle that's being explored through some researchers. And one analogy I like to use, I heard from at a trails conference one time, was, community wants to invest in some outdoor recreation, and maybe the options are a baseball, softball complex or a bike park. And let's say the bike park costs $600,000. Let's say the softball diamond is $600,000. Look at use. The softball diamond is mostly a sedentary space, a few little sprints here and there, but pretty a sedentary area, and it's used 3 or 4 months out of the year, as opposed to a bike park, which might be used by a population 8 to 80 year round. So looking from the health benefits, where would you invest your money, and what's your return on, improving the community is clearly this bike park would be a better example. So that's another way to start thinking of these conversations. All been talking about collaboration, how to have common language. And years ago is Parks and Recreation. We're the mindset, if you build it, they're going to come. And public health wants to know how many Hispanic females use it Thursday night in the rain at 7 o'clock. So evidence-based versus, hey, it's cool, it's going to happen. And so we're still in a very different space on language and conversation, and that's got to change if we're going to have wins for both sides on one project.
That's great. Thank you, Attila. And Phil, can you just briefly mention the project you guys are doing with your Trails Health Calculator for folks who haven't heard about that before?
Yeah, sorry, there's my video. Yes, the Trails Health Calculator project would be pilot tested with the Cara Trail Network. That's the lower Texas Valley. So Brownsville, Laredo, those communities down there, and the Rails Trails Conservancy has been working on the Cara Trail System. So we're looking at finding funding to pilot test this through UT and through Oregon State, the two researchers. And the idea is we can pilot test that, we do more peer review, refine it, test it in some other areas for a national idea. But the idea that Shift would like is that it's a easy, public, fillable, fill out the form type of a tool that it wouldn't take decades of deep dive research to do. But the idea is that we can quickly crunch some numbers on existing healthcare costs or these trail costs and try to figure out what a healthcare savings could be by implementing this trail project in the community. So that it has some movement within Shift. I've secured a little funding for it to start with. Just found out today we got a little bit of funding to maybe move that to the next piece of the project.
That's
So it's
great.
kind of exciting that we can move there, because I think that's going to answer a lot of those questions for us and to the policymakers in the community, why we should be investing in parks and trails, because there is a return on investment, as Matt was alluding to earlier, one of the sessions.
Yeah, I think that's a beautiful example of some of the projects and data generating initiatives that we can be using to, expand the scale of this. I want to move us to think about next steps. I apologize to anyone who's put questions in the Q&A that we didn't get to. Maybe I'll just do one of those questions real quick for you guys. If this jogs your brain at all. The question is about whether we risk commodifying nature by talking more about health benefits, monetizing the benefits, focusing on these trade-offs. Can anyone comment on the risks of commodifying nature, or whether we're kind of past that worry?
I'm happy to let other people speak, but I've done some research with economists on how incentivizing things monetarily undermines intrinsic motivation for things and therefore devalues them. So that's quite a well-established concept. However, the whole ecosystem services framework is underpinned by an economic analysis of what is the world and the planet of the resources worth. And at the current state, they're undervalued. They are clearly undervalued in decision making. So I think, I'd love to hear the other panel members, but we've surely got to at least bring it up so that it's on the spreadsheets.
Yeah, I would agree with that even though there are risks inherent in taking this approach, the current status is to undervalue all of these resources. And even as we're starting to view them as more beneficial for society, we're struggling to meet the demand with the resources we have. So let me just turn us, we just have a few minutes. On our agenda, it says next steps. And I just wonder if I can challenge anyone, and I include our breakout hosts, to form for us, just a few things that they think we could start doing more of now, or that they'll try to do from their end. I'll say one from my group, which is we came up with this idea that we think we're talking about health benefits of nature, but we're not doing it enough, and we're not asking other people to do it. And that's something from my perspective that is a next step that I can pick up. It's not going to take a lot of extra resources, but it involves me, reorienting what I'm doing.
I can share maybe two things. I dropped a note to my friends at the National Recreation and Park Association just to find out if they're collecting or tracking those budget wins. So I'm interested to find out the answer to that. I think that's a really great way to keep a lot of this work asset-based, is to lean into that celebration. And the second thing is just knowing, thinking about the challenge that's being put on staff. Healthier Generation does a lot related to staff self-care, stress management, social emotional health. So if anyone's interested in sharing their ideas or collaborating on something related to that topic and kind of baking in nature to our messaging, I'll put my email in the chat box. Love to talk to anyone.
That's great. Thank you, Daniel. And extra comments have come in on the chat about how we should probably be talking more about stewardship, particularly in the time of COVID, trying to get people to engage with nature in a less degradative way, which I think is a good goal we can pick up as well. So we've just got another minute. Nothing else is coming in. Anyone have any final thoughts for us? Great. Well, this has been a really fruitful, interesting, exciting few hours. I appreciate everyone who joined us. We've had folks from the land management community, the research community, the health community, the Parks and Recs community. It's been a really diverse group. Somebody pointed out that is what Shift does best. And I'll again encourage everyone to reach out to anyone they've seen on this call or in their small group to try to foster some of those partnerships we've been talking about. And I know I'll speak for the panel. Feel free to reach out to us if you have questions about anything we've shared about our work. Thanks everyone again. Oh, and I've been asked to tell you to attend today's poster session. So we're gonna have a big poster session at 3, followed by individual breakouts with individual researchers. It's gonna be new from years in the past, and I think it's gonna be really good. Thanks to everyone. Thank you to the panelists, and we'll see you at the rest of the sessions.